Hey guys, Professor Onstead here today. Um, we you had the lecture on compression, and two of the things you're going to do for skill checks are one is ACE wrap, one of your classmates for a sprained ankle. Okay, so I'm going to show you a few things here today before you have to do that. Okay. So, as you can see, I've taken, remember these from anatomy, the lower extremity here. I've taken one to show you how we do a really nice ACE wrap to work on compression for somebody who's had edema from an ankle sprain. Okay, so remember yesterday in lecture we talked about the different guidelines for ACE wraps. Okay, so let's just go over those a little bit. When we're ACE wrapping, you guys, we're going to be doing more pressure distally and less pressure going up proximally, up towards the knee, okay? This way we're going to help the compression, help compress the edema that's distal here, which if anybody's had a sprained ankle before, you know that there's going to be a lot of edema in here, okay? So that is one of the rules. More pressure as we go from proximal to distal. I'm sorry, distal to proximal. And the other ones are there are no wrinkles. You can see here. There are no wrinkles or gaps. Okay, what a wrinkle can do is create friction in that area. What a gap will do, and often you guys, this is where you don't check as you're going up, is at the heel, is that you want to get through that ankle too quickly, and there's often a gap here where there's no ACE wrap covering the heel. So always, 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 before you start going all the way up, make sure that you have covered the heel completely. Because if there's a gap, what is going to happen there? Well, there's going to be, fluid is going to go where there's no compression, right? It's just going to go and it's going to pool and it's going to create a blister. It's just going to pop right out, create a blister. The blister is going to pop and now you have an open wound, which is a greater problem for your patient, okay? Your athlete that's trying to get back to their sport, okay? So no wrinkles, no gaps, really important. And then, of course, we do a figure eight, right? Really important to do a figure eight. You can kind of see that here. Let me get the lighting correct for you. As you can see, as we're going up in our figure eight, we have an angle that's always going up, okay? And we cross over, as you can see here, that we have a nice pattern going on here. Boom, crossover, 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 okay? And that we're keeping the same amount of gap, I should say, fabric consistently, okay? About 1.25 inches or so, okay? So that is another feature that we always do is a figure eight, and I'll be showing you that. The other thing we don't do, obviously, is go into the popliteal crease. If this is this patient's popliteal crease here, we don't want to go in there because we know that there are vessels there, veins, arteries, and nerves, and we don't want to compress that. We're trying to get the fluid up, and we know that the knee area is very rich in lymphatics, I should say, and lymph nodes, and so we're bringing this fluid through compression, helping support the vascular system, particularly the lymphatics, which is going to bring the fluid up into the venous system, and eventually it's going to go through the subclavian and back into circulation through the heart. Okay? All right, so we end that there. So you might notice that there's kind of a strange thing here. I have taped off the end of the second ACE wrap. We've connected one ACE wrap to a second one to get up towards the knee. And this is what you do, you guys. You don't just keep wrapping or start going concentrically to use up the fabric, okay? What I do, because every patient's different, I'll work with a patient and they'll have a longer leg and it'll end just fine. But sometimes, the shorter tibia areas, it'll end sooner. And so I just cut the ACE wrap off, okay? And I throw that chunk away and then I tape it down. We don't want to keep using this if there's no place to go, which would be the popliteal area, or start going concentrically, okay? So it's really important you do that. So I've just taped it off here so that you would see that there might be extra fabric we would use. Okay, so that is reviewing that again. We don't go in the popliteal area, okay? We use a nice figure-8 pattern all the way up, which you will get very good at if you practice a lot. And we have more pressure distally with the wrap and less going up proximally, okay? So we can help that fluid go up towards the heart where we know it needs to be going, okay? And no wrinkles, no gaps. We also, lucky this patient here has, we also do an ACE wrap in neutral, okay? We don't want to be in a either a really dorsiflex position or a plantar flex position, okay? We want to ACE wrap them in neutral, okay? So that's that. We know that ACE wraps are a long stretch compression wrap, right? So when we look at an ACE wrap, we have 100% stretch, about 50% stretch, and then no stretch. So 50, 100, okay? When we're wrapping, we want to be mindful of how much stretch we're putting on. So the more stretch, the more compression, right? Okay, so we've talked about having more compression distally than proximally, so we're going to have a bigger stretch on this, and as we go up, it's going to be less and less, okay? All right, so we want to get started, and it's really important when you get started, you guys, to, you know, have your environment set up. Remember, we've been talking about that? So even though you're doing electronic documentation, you're not going to remember all these numbers that you're going to be writing down or have in your head to go put on, you know, on your documentation and the electronic on the computer. So I always write some things down, my objective things and the subjective. So get in the habit, you guys, when you're having to write things down, is just put an S there. And as they're telling you they're subjective, oh yeah, I sprained my ankle playing soccer, and you know, I ran into this divot and twisted my ankle and that kind of thing. You're writing that down. But also you're creating your little chart of what you're going to be assessing, okay, of what you're going to be collecting data on. So the first one is observation, okay, palpation. We're going to check for a Hohmann sign or a positive Hohmann sign. We're going to check sensation, and we've got to check pulses, right? The TP stands for the tibialis posterior pulse, and the DP is dorsalis pedis. Sorry, look at that upside down. And then lastly, we'll do a girth measurement. Okay, we're going to compare girths, and we'll use a figure-8 for that. Okay, and so we have a column for the right and the left. Okay, depending on which one's involved. Okay, all right. So that's one thing. I want you to take a little look here at a setup. Okay. And I always just, you know, a lot of what we talked about earlier was preparing for a treatment. So go and grab your ACE wraps. I often get an extra one because ACE wraps sometimes all of a sudden fly out of your hand, and you know that it just happens. You want to get some tape, okay? You're going to be taping. Measuring tape for doing a girth measurement. And then I always just, you can see I've cut or ripped off tape here. I like that ready to go. I don't want to hold on to an ACE wrap in place while I'm trying to get tape off. So just get prepared that way, okay? And then I have my thing to document on, okay? All right, so let's take a look here. Joe is here with us again today, being a wonderful patient as usual. Hi, Joe. Okay. Let's get you guys set up so you can see Joe here. Okay. Okay, so I wrapped Joe's lower extremity here, as you can see. Another wrap where you can see that there. We've again got that nice cross hatching at the same location all the way up, okay, showing a good figure 8, okay. All right, so I'm going to take that off, just so you can see that, and talk to Joe a little bit here. All right. You can see this. So we're going to have the other lower extremity, as we always do, we're going to measure everything over there too, right? Because we need to see what's normal for Joe and what is abnormal since he sprained his ankle, okay? You'll get good at unwrapping and wrapping these up, okay, you guys? Joe's got quite the lateral malleolus here we're going to get around to, okay. Okay, so here I am talking with Joe. Grab my pen. Hey Joe, how you doing today? Yeah, oh, you're a soccer player? Okay. So you injured yourself playing soccer? Okay. And how many days ago was that, Joe? 3 days ago? Okay, 3 days ago. Days ago with Joe. And how's the pain level, and where can you show me where that is? So he's showing me this lateral malleolus area. We know that this is the most common, is to disrupt your lateral ligaments. Probably 90% of the ankle sprains you're going to work with are lateral ligament sprains versus the medial side. Okay, so he's told me that he's got a pain of about 5 out of 10 right now. Okay, and you can go on and on with the subjective there. Okay, so first I'm going to observe. Okay, I want to be looking. What am I looking for? I'm looking for, does he have any abrasions, any cuts or scrapes anywhere? Okay, I want to be looking, any blisters already, looking at the uninvolved side first, and then I'll go gently. Okay, this guy's got a sore ankle. It might be all puffed up, you guys know. And I'm going to just look, say, Joe, yeah, did you fall when you sprained your ankle? Yeah, I fell. I got a little scrape here. Okay, I see there's a little scrape here. And so I'll document that. Okay, but being very gentle with that. So how would I document that? Okay, I'm also seeing that there's a lot of ecchymosis here. Okay, so this is his left leg. I'd put ecchymosis, peri. Peri means what? Around. Peri malleoli, lateral malleoli. Okay. Okay. And, small scrape, abrasion, we'll call it an abrasion. Lateral tibia, lateral mid tibia, okay? This one's fine. What I like to write for that, you guys, is NSF, no significant findings. NSF, no significant findings. Okay, next I'm going to do some palpation. Just quickly palpate here, making sure that you have a general idea what is normal for this patient. And then coming in gently palpating, we're getting a sense of what's going on here, checking a little temperature, okay, feel the difference in temperature. We always use the back of our hand or digits for that, okay. And what am I going to write there? Some typical things for palpation would be, I might say, moderate edema. I may not want to do any pitting right now because he's in a lot of pain. And pitting is going to go away pretty rapidly with an acute sprain, acute edema, okay? But I might say moderate edema, okay? And that there's a moderate increase in temperature, lateral malleolus, okay? And again, what would I put over here for palpation? No significant findings on his right lower extremity. Homans. How do we do a Homans, you guys? Okay, a Homans, and you would want to say to the patient, you bring a patient up into dorsiflexion. Remember, this is sore, so don't jam his edematous sprained ankle, right? Just say, any problems with that anywhere, Joe? No? Okay. Any problems with this anywhere, Joe? Okay. Why don't I say, do you have pain in your calf with that? Because that's just a leading question to ask a patient. I'd rather have a more objective answer from the patient. I'll just say, any problems with that? Oh, that hurts my ankle. Any other areas where that gives you a problem? And if they were saying in their gastroc area here, which is where we would find a positive Homans, and what is a Homans for? It's one assessment for finding out if you have a DVT, deep vein thrombosis, right? Okay. Other things are temperature, okay, and edema. But we know he has edema from an acute ankle sprain, okay? So what do we put for Homans? Negative. Just put a negative, negative, okay? You might be wanting writing this down, you guys, and just fill in your chart so you kind of think about that. Sensation. Hey, Joe, I'm going to just be kind of touching you like this on your legs to just check your sensation. Just say yes when you feel it, okay? And I want you to close your eyes while you do that, okay? All right, so here we go. He says yes, yes, yes. Don't be predictable with this, you guys. Go somewhere else. Don't be predictable. You really want to be checking his foot, right, for sensation. Does he have a sensation? I mean, we don't care so much up in here. This is where a lot of the injury is here, okay? So you're checking the digits, the heel, the plantar surface, the dorsum as well, okay? And how do we say if Joe's sensation is normal? What do we say about that? We say it's intact, okay? His sensation is intact bilaterally because he was answering the questions correctly. And now pulses, okay? I'm going to check our dorsalis pedis. Make sure you know how to find that. I just use 2 fingers for that. We never use our thumb, right? Of course. Dorsalis pedis, okay? Spend some time there, find it. It's a little different location for everybody, as we know. We're all different. Okay, normal. I go right to this dorsalis pedis here, find it, check on that, give yourself a few beats, okay? At least a few beats, making sure that the patient has a pulse down there. We want to check the TP. That would be the medial side, right, below the medial malleolus. Remember your sustentaculum tali? I love that word. Come just to the sustentaculum tali, just a little inferior and posterior, and there you've got your TP pulse, okay? Show you that again, of course. Joe just has a big giant bolt here. Okay. But you'll be checking that both sides, okay? And giving yourself time to do that, you guys. You really want to know, is this patient have a pulse? Sometimes when people have really, really maximal edema, their pulses are affected by that, okay? They can be compressed and all that kind of stuff. So you want to know that because now you're going to be putting more compression on, okay? And you want to be making sure that the toes and everything. And I'm also always looking at toes to look at, I should have mentioned that when I'm looking at observation and making sure that they're healthy vascularization here, nice and pink toes, not purple or blue and not white or cold, super cold, okay? And we'll talk about that after we wrap too. It's really important to check toes. Okay, so we did the pulses. Okay, what is a normal pulse? We put a 2+, 2+, 2+, 2+, girth. We're going to do a figure 8 girth. Okay, remember how to do that. I know you learned that in data collection with Professor Daly. Start here, come around. One of our landmarks is and I'll show you when I get to the left foot, is the distal head of the 5th metatarsal. Okay, going around on superior, just superior to the medial malleolus, superior to lateral malleolus, and then finding out where that is. Okay, so we'll say that Joe here is 21¼ for his normal lower extremity. That's his right one, 22.25. Okay, so let's take a look here. Again, I like to start on top. You know, everybody does this differently, you guys. Okay, you guys see this here? Yeah. So here's, you go palpate, find that distal head of the fifth metatarsal. Okay, I do it, there's a little groove there, I just put it right in. Bringing this around here, just above the lateral malleolus. Okay, just above the medial malleolus, and find out what that is. Okay, you don't pull it tight, you never pull it tight. You just, when you do a tape measure, you lay it down, you guys, okay? Because you shouldn't be making a tight pull in here. So we're going to say, I'm going to make this up because, you know, he's supposed to be a Demodeus. That other one was 22 and a quarter. This one's going to be 24 and a quarter, okay? 24 and a quarter. Now, you have your measurements. You're ready to go, okay? All right, Joe. I need to tell you more about, you know, they like to talk, and you're talking to him about his soccer match and what position you play, Joe. Oh, you're middle fielder, or you're center, or winger. Okay, whatever. Okay, so let's get a different one. A little tighter. So again, remember, you guys, we have our stretch, full stretch, 50% stretch, zero stretch. Okay. So we're going to start, and we're going to anchor this. I think I'm still in there, view of that, yeah. I'm going to anchor this. Okay, while I anchor it, I'm not so worried about the dorsiflexion, right? Now I'm going to start thinking about the dorsiflexion. Okay, I've added a lot of stretch down here. The other thing, you guys, when you're holding on to the roll, don't get way out here, okay? You can't control how much pressure you put on, or how much stretch, I should say. Okay, so now I've just done a lot of athletes. I often have them, so I know it's in their ankles in dorsiflexion. I often have them here. I put a towel over my, you know, my shoulder and that, so that their nasty little toes are not on my clothing. Okay, but everybody does that differently. You can do it down here. What I don't like people to put bolsters here. Why is that? Because when you put a bolster here, you're impeding the flow of his venous return and his lymphatics, right? Okay. All right. So again, here we are. So we're going to anchor that. We're going to come up here. Just do two anchors here. We're going to come up here, and we're going to try on Joe here to make sure that he's not having a lot of wrinkles, but he is. Okay. And I just start now with my figure eight. I went around the ankle, okay. Now I'm going to start my figure eight. This is a little more difficult to not have wrinkles because he's sliding around. Okay. And this is where I want to start my pattern, you guys, okay. I'm going to start my pattern right here. I'm going to go down again. I need to capture that heel. I'm going to make sure I captured the heel, guys. Okay, thank you, Joe, for that demonstration. All right, and now I'm going to start with my pattern, right? Up. So what you want to be thinking about is up and down, okay? And laying it down exactly where you want to lay it down, okay? So if I've laid one here, I don't want to lay it over here. I don't want to lay it here. I want to lay it right here where it's going to go up, okay? And same here. If I'm starting my pattern here. And I can't see that too well. But when you guys are in lab, I'll be working on that with you. Okay, so I'm going up and around and down. Okay, so I didn't, you know, Joe has a pretty good size leg here. So I'm going to end this here, and this is why we have the tape ready to go. Okay. Make sure you get a good seal on that tape, you guys. There's nothing worse than getting this done and a patient stands up and starts walking and all of a sudden it starts unraveling, okay? All right, there we go. So let's go and get our next ACE wrap. So when we've ended somewhere, we're going to just come and find where we ended there, or we could. Well, let's just do it this way. I'll show you two different ways. Okay. And we just hold on to that, and we just start coming down again. Okay. So down. We're following our pattern. Up. We're following our pattern. Down. We're following this pattern all the way. You guys see that? It's hard to probably see that. Up. I'm following that pattern. Down. See how I'm not getting too far away? It's like a handoff behind the lower extremity. Okay, I'm following that pattern, trying to keep the same width all the way. Down and up again, around and down. Okay, keeping that. We have to be really, consistent with that, you guys. Okay, and then up again. Okay, so we didn't get into the popliteal area at all. And Joe is happy, aren't you, Joe? Joe is always happy. He's a good guy. Okay, Joe's always happy. Joe's a soccer player. Soccer players are happy. Okay, we're going to get two nice pieces of tape on that, okay? So that doesn't pop off. Okay, so let me see if I can show you guys. I'm not sure you can really see that. I think you can kind of see that a little bit from the side. Let me do it this way. Hey, there you go. So you can kind of see how we've done that nice pattern all the way up here, both places here. We made sure that we got coverage. And, okay. Very few wrinkles, no gaps. We checked the heel on the way up. And, okay, we had more pressure here, less pressure up here, just kind of laid it on there. Didn't go into his popliteal area, which is, excuse me, still up in there, okay? So that's an ACE wrap, you guys. Now the things that you're going to need to do, okay, for your skill check is making sure that you know your contraindications and precautions, and there are a lot for compression. I know there have been a lot for many of the things you've been working on, the E-stims and ultrasounds and all of that. So you're going to have to be able to come in, tell me what those are before you even start, and so I know that you understand those. We'll talk more about that when we are actually here in lab, okay? So the one thing I did want to say is we're going to finish this up with Joe and tell Joe, so how does that feel, Joe? And of course, all the way along the way, we should be asking Joe how it feels. And then we want to check digits, okay? If there's too much compression, toes are going to go purple or white. And actually, every year there's students that wrap, and they're doing a great job, and they're doing good compression. And then as they're educating the patient, I'll say, hey, did you check the toes before the patient left? And they'll look down, and every year there's some patient, one of you guys, they have purple toes. And that means that probably they got too much compression here at the dorsalis pedis, okay? It's generally that one there where you got a little too heavy with the compression down there, pulling it tight. And then I bring all the students in to show that because it's real. You have to make sure that your patients aren't leaving and you're restricting their blood flow from compression, okay? And they're all like, wow, it really does happen. Of course, we don't tell you things to do just because they don't happen, because they do happen, okay? So then you would rewrap that, right? Okay. The idea is that I don't have a patient learn how to do or try to learn how to do their ACE wrap at first. Generally, when they're done with an ACE wrap, I put them into one of those neoprene sleeves, compression sleeves that you can pull on for your knees and your ankles. Because this is very hard to do, and we talked about in lecture that if somebody started doing concentric wrapping with their ACE wrap, and they started, restricting blood flow, and they go to sleep that way, this can be a real weapon. I mean, you can lose your foot this way if you compress, if you do a circular and create basically a tourniquet. Okay, so so I always tell my patient, hey Joe, you know what? I just want to make sure that you're checking, if somebody else does this ACE wrap, and if it's a family member that says, oh, I know how to do it, I know how to ACE wrap, I will have that family member come in and show me their technique, and then I will assess if they do it correctly and safely, right? Because it's not, if I go and say, oh yeah, well just have your family member do that, that's I don't know their capability. I don't know if they know how to do it. Maybe they're doing concentric stuff. And so if they, have a partner or a mother or father that know how to do it, I said, okay, have them come in, and if they're doing it correctly, then they can do it with you. But the best thing to do is have them go out and buy a compression sleeve. So they put a compression sleeve on, the neoprene sleeve, okay? And that's usually what I tell them to do, because it's very hard to ACE wrap yourself correctly, okay? Some people can do it, but it's very difficult to do. Okay, the other thing I want to tell Joe is I want to give him some education, right? Okay, is that when he's not, that he can do ankle pumps, he can do toe, spelling with the toes. I don't know if you've learned this anywhere in any of your classes yet. But use your toe and you pretend you're writing the alphabet with your big toe, okay, so that gets your range of motion going. So I often have them do that, plus dorsiflexion and plantar flexion, and keep that blood flow, okay. Often these patients are on weight bearing as tolerated, but they don't they don't tolerate a lot. So they're probably on crutches, and they're probably just doing some toe touch type stuff, okay. At first, okay? So, anyway, so Joe, I want to teach you a couple of things. There's something called PRICE, okay? And it's an acronym for protection, okay? So you want to be protecting this lower extremity, not bumping it into things. R is rest. Right now, you can't get back on the field, so rest, okay? Ice, okay, teaching them how to ice without, not wrapped, not a compression, right onto their skin. You've done that with Professor Daly already, okay. There's always a barrier with the ice, either a pillowcase or something like that, so you don't ever put ice directly on the skin, okay, unless you're doing a cup, ice cup. Okay, C, compression. That's what we just did here, Joe. We did a compression bandage wrap, okay? And E is elevation, okay? So, Joe, when you're lying around watching TV, watching soccer, Premier Cup, all that, I want you to get your leg up, okay? Your ankle needs to be at your heart level or above, okay? So the best thing to do there, let's show Joe, is to bring you down there, Joe. Is for Joe to elevate his lower extremity on some pillows. Okay, making sure that he's got some pillows under his knee as well for comfort. And so that this, again, is above his heart. Okay, all right, Joe? All right, and so what else are we going to check for, Joe? Joe is telling me, good body mechanics here, Joe's a heavy Usually the patient would be able to come up and go into some flexion of his trunk using his abs, but Joe cannot. So, all right. We would want a pillow or something behind Joe here because he was awfully... anyway, pillow behind Joe. Okay, so you guys, that is ACE wrapping. And, when you're going to be doing your... when you're going to be doing your documentation, you've already got all your data collection in your O. The other thing you have to say is that, maybe what you did before this, you did some effleurage massage, okay, which is a really good thing to do. Lymphatic drainage technique, something like that to help get that pumping up there, that fluid out of the interstitial space and into the lymphatic system to eventually dump into the venous system, okay? And so you might say that, document your efflage massage, your LDT, and then document that you wrapped the patient from toe to knee, to just below the knee, using 2 4-inch ACE wraps, okay? You have to kind of say what it is, okay? All right, okay. Your assessment would be that patient, understands price, okay? That you were, understands your in the O, you'd also put that you asked him, demonstrated how to do the alphabet with the toe and the dorsiflexion and plantar flexion in small range at first, right? We don't want a big range because that one, it's going to be painful for him. Okay, so document that there in the O, and then talk about how he did. Okay, patient tolerated treatment well, seems to understand when to check his digits for circulation, that kind of thing. Okay, so all right. Plan would be, assess patient next time for decreased edema, whatever else you want to put in there. Okay, we'll talk more about that when you're here in lab. Okay, so I think that's about it. Thanks, guys. Hope you're having a good day. And thank you, Joe. Joe's always, I gotta thank Joe. He's always helping us out here. All right, guys, so hopefully that is what you understand about ACE wraps, okay? And you'll get really good at this because guess what? When we get to the advanced class and we're working with amputees, you're going to be using ACE wraps again for compression for edema management for those patients as well. So this is a skill that you can have, and I know a lot of the students that go out to clinicals and they have to teach, do an in-service and teach, they often do ACE wrapping and how to do it correctly because there's a lot of therapists, there's a lot of nurses, doctors that do not know how to do a proper ACE wrap, and an ACE wrap done improperly can be a dangerous thing. I looked on YouTube for an ACE wrap video, so that I didn't do this, although I like doing this. And I went through like 10 that did not address the things that really need to be addressed, and some of them were really wrong. Doing circular ones. And I was just like, are you kidding me? So anyways, bye for now. See ya whenever. Okay? All right. Take care, guys.